All right. Welcome to our free webinars again with Freedom Healthworks. I am Sarah Harker, the Business Development Manager at Freedom, and I am so excited that these are back on. You have a really special treat today with Katherine Feley, the CEO of the Indiana State Nurses Association. Welcome, Katie.
Hello.
I'm so happy that you're joining, and I love that we coordinated lipstick without even knowing.
Yes, we look like a great team together. No.
We sure do. So I'm so excited to have you here today to talk about one of our favorite topics. You and I have had many conversations about burnout over the years, and especially for nursing, for nurse practitioners that are in this direct care world. That's something that we talk about often. Very often I hear people saying they're leaving traditional medicine, getting into direct care, and opening their own practice because they just can't keep up, whether it's the demands of administration or insurance, or as we all know, a lot of times NPs get all sorts of things thrown at them that other people don't want to take care of. And so something that I hear commonly, and you are such a bright light, and I'll say anti-burnout specialist. And I love so much about you, but especially that you practice what you preach. So really excited to have you on with us today to talk a little bit about your recommendations for burnout and also how you apply them in your daily life.
Yeah, so I'm right here with everyone else. The demands that are put on us on a regular basis, they're difficult to climb through and sort and get to the top of things. And it's interesting. Self-care has always been important to me for the majority of my life, especially my adult life. But now that COVID has come and changed, really rocked our world, self-care, especially in healthcare, is a priority, is a focus. And I struggled for a while because while I found self-care to be important, wellness and taking care of my own body, I found that the topic of self-care was almost becoming a burden. It's almost now you need to be taking care of yourself. How are you doing it? What are you doing? And so really, I wanted to talk about the self-talk about self-care today.
Love that.
Because it's a really important piece. So I was in a webinar a couple weeks ago, and someone used the term informed steward.
Okay.
And it really hit me because I have seen myself as someone who likes to try new ideas, new topics, new activities related to self-care, whether it's meditation, yoga, journaling, not my favorite, but I had to learn that the hard way. Mindful practice of gratitude, breathing techniques. And I realized that I like a little bit of everything. And when this person explained how to be, it was about the body, and it was how to be an informed steward, a sponsor, a leader of your own body. It's really finding how to stay in tune with what you need and what you want in the moment. And part of that is how you're doing your self-talk. So they kind of go hand in hand. So the push for more self-care is all around us. You know, what are we doing individually to prevent burnout? How are we staying engaged? And I find that while I'm a list maker and a check boxer and a people pleaser, I find myself moving and shifting and flowing in different self-care models. And at first I was like, why can't I just stick with something? So I mentioned the journal piece, right? I have a friend that journals every day. She journals every day. She has stacks of journals. We travel a lot together. And before she gets in bed at night, she grabs her journal. And I think, oh, I wish I could be a journaler. It's not like that. And so I realized that the self-talk around the piece of journaling not being my thing is okay. And when I see her journaling, and I can just say, that's not my thing.
Yeah.
But I am going to think about what I'm grateful for today before I go to bed tonight while she's doing her journaling. So when we think about how we're taking care of ourselves, self-talk is extremely important to stay away from those negative thoughts of, oh, I was wanting to work out 7 days this week, but I only worked out 2. Or I only worked out 1. saying that's okay, that I was able to enjoy that workout or able to find the time, create the space to do that workout. So, Sarah, I'm sure you have your own self-talk, your self-dialogue that goes on as you're doing your self-care. What do you think about the self-talk?
I love that. I love that so much. I think that's a great place to start with when you're talking about self-care, period. You are very familiar with my favorite mantra, which is I have the ability to be influential. And I think that's one that just covers all areas. And I think that's a perfect place to start with that positive self-talk of, jumping into it. Just like you're saying with, the gym, you've got the ability to be influential in your own life and you stand tall in that, regardless of what that looks like. And you have the ability to be influential in your own self-talk there as well. Yeah, I like that a lot.
So I found that my self-care kind of moves with the changes in my life. There are times that I'm focused on exercise or physical movement or focused on hot yoga. But if I tell myself I'm going to do hot yoga 30 days in a row or every week for the rest of the year, I find that it's easier for me to get into a rut of negative self-talk when something changes in my day-to-day. My daughter gets sick and I'm not able to go to hot yoga. I try to stay positive and tell myself, then I will just move to a different option that I have today. A couple weeks ago, I miraculously did not have any 9 o'clock meetings on my calendar. I usually start my day around 8:30, 9 o'clock, and I'm usually at it pretty early. By the time I get here, I'm diving right in. And I was able to actually spend a little bit of time over that week before work, getting able to do something that I find very enjoyable in my self-care practices, which is knitting. Sarah knows that I like to knit when I'm able to. It's a kind movement, a creative movement with your hands. It's a counting. You focus on your breathing when you're working on something that you're creating right in front of you. And I was able to do that for just a few minutes before work. And I loved every moment that I was able to do that. And I considered it to be self-care.
Yeah.
But the next Monday that rolled around, I had my meetings right at 9 o'clock. And after that, and I looked back and I thought, that was a really nice time that I had. And I was joyful for that experience. I flipped that self-talk from saying, I wish I could knit every morning before work. And I wish that this week I didn't have these 9 o'clock meetings. I turned that self-talk into, I really enjoyed those moments. And when I'm able in the future to create those moments again, I'll be able to celebrate with them as well.
Yeah, I love that you brought up knitting. I was hoping that you would. I think this is so interesting. So I worked at Georgetown Hospital in DC many moons ago, pre-kids. And I always thought it was so interesting. They actually had a family that donated a whole area just for the nurses, for a break room, but it was just for the nurses. And they had a quiet room there. And one of the things was a basket of yarn. And, at the time I thought, I'll never be able to sit still to do something like that. And now it's something that I crave like you do. I actually do it often in meetings and it helps me focus more, especially when you work from home and people can't see your hands under you, right? So, but I just thought that was so interesting that was part of something that they implemented at a magnet hospital of being able to rest. Of course, there was coffee and actually there was massage chairs. It was a really unique experience. But I think that's so interesting when, us as nurses, we know sitting still is rarely something that we're all good at.
Right.
Yeah.
So those quiet moments, to find purpose in those quiet moments, really, to turn that self-talk into gratitude. And even if it is just for a moment, enjoying that moment.
Yeah.
When you may not have a space like you were just mentioning at work that is that lovely. However, when you're in your car on your way to work, think about the weather outside. Think about the ability to head into work. The enjoyment, is your seat warm? Are you get to set your AC or your heat right where you want it, right? So there's these little moments. And as you bring those small moments over time, they grow into larger moments.
Yeah.
It's sun shining. Is your favorite song on the radio? and thinking about the positivity around you, it will spread throughout your day. So having just those teeny tiny moments is
Yeah.
how I like to incorporate self-care throughout the day.
Yeah. What do you think about this with direct care? You know, a lot of times these are nurse practitioners, PAs, people walking into a whole new world. They're used to coming, you know, from a network where every moment was determined for them. And often, you know, I always joke about we have a large hospital system near us that calls something bio breaks. And I thought that's so funny. We have to come up with a term to be allowed to use the restroom. You know,
Yeah.
you're coming from this area where they maybe talked about self care, but kind of in a surface level way. And now you're taking control, you're opening a practice or joining a practice where that's part of the focus is we want you to be able to balance that work and life balance. But oftentimes you come into things kind of like what you deal with every day at the Indiana State Nurses Association, but more business focused where you have more on your plate, but you're able to determine your time more. How do you do that, Katie, with a huge day, a huge agenda? How do you set that out and incorporate that into your day?
So when I'm able to, I really like to block moments. We're not going
Mm-hmm.
to call it time. We don't always have the time that we want to really give to spend on self-care or
Sure.
to spend on these mindful moments. But I create as much space and as much an open pathway to create or to accomplish some of this self-care in small doses throughout the day. So for example, right here in front of me, I have a card deck. It's actually, I'm going to call it a naughty card deck. It has some profanity. I don't know if you can see
Oh,
that on the
sometimes that's
side.
even better.
It's affirmations. And they're just cards that you can flip through. And, you know, in between meetings, in between patients, or in between your webinars, if you have it out in front of you on your desk, you can just look down and choose to take that moment to flip that card over to read that affirmation for the day. And then this affirmation may stay this face up for a couple of days until I have that moment again to choose to pick up the next affirmation card to read through it and think through it during that moment. Um, Having those moments throughout your day, whether it's when you first get to work or whether you pause for lunch and to maybe close your eyes for a few minutes during your lunch break and have a positive moment about your day so far. Even if you're having a stressful day, choose to find the good out of that
Yeah.
stressful morning and how you're making it through, you're persevering. And then also when you close the day, it's nice to close and shift your thoughts from your work process and you're going straight into your home process to actually close it. Try to close the part where you're dealing with work and moving on to now I'm going to head to the grocery store. What do we need today? So kind of incorporating those moments throughout your normal flow of work, I find to be helpful.
Yeah. I like to call those hat changes. I think it just kind of puts a kind of a fun picture with it. I started doing that during COVID. I love Headspace. I love meditation. That's one of the things when I went from I can't sit still to I'm going to learn how to sit still and see if that's something that actually does serve my body. And I was shocked to find out that it actually is very helpful for me. But what I like to use Headspace for that. You know, they have 3 to 5 minute meditations that you can use, and I'll often encourage people when they're getting into this new role. Once you get to the office or you open your computer, regardless of where you are, do that hat change of a 3 minute meditation that helps you switch off whatever that is, and then I know when I hear the bus coming around the corner that I've got about 3 more minutes before my own kids show up, and then I've got another hat change, and I want to be present for them and that not transferring the stress that I have from work that day off to them. So that's another area. One thing you're really good about is boundaries, and I think that's such a hard one. What would you say to the person who's getting into opening their practice that they are the one that's in charge of choosing their time, but how do you switch that off? Sometimes when you're the only one running, that gets hard.
Oh, what I really want to go back to is you can't pour from an empty cup, but we've heard that so many times. But honestly, it's true. It's true. And so it's important to create those boundaries, boundaries with time, boundaries with relationships, even back to those bio breaks. bio breaks are purposeful, right? To have that time, boundaries of having 45-minute calendar schedules instead of an hour, right?
Mm-hmm.
To give some time for you to take a deep breath, to look away from your computer screen, to move your affirmation card over for the day, if that's the time you so choose. So I think having the self-talk to promote setting those boundaries, that you're able to set those boundaries, to be an informed steward when setting those boundaries. Without them, I don't know that we as leaders, we as nurse leaders, can be as successful as we need to be. So
Yeah,
they're extremely important.
Yeah, when I'm thinking direct care specifically, one of the first ways that I start feeling people pushing the boundaries or struggling with setting those boundaries is with what we call meet and greets. So a lot of times we'll have a patient that might be a potential member of the practice, and you're wanting to meet with them to see if they're a good fit for you and you're a good fit for them. And one of the biggest ways I see people struggle is they'll say, Sarah, I just don't understand. I sat with them for 45 minutes and they didn't convert over to a member. And I'm like, you did what? A meet and greet, something that's a 15, 20-minute conversation, not a health consultation. Maybe you're talking about your health goals or the patient's health goals, but you're not getting into diagnosing that or winning them over by your skills and things like that. So that's one of the very first places I see when someone opens a new practice, of making that time set for them to show them that you're somebody who sticks with what your word is very important. And I think sometimes that's easier to flip that switch in your brain of you're sticking to your word rather than I'm withholding from the patient or something like that. It's all about that self-talk, like you said. I love it. Say that again. Informed steward.
Informed steward.
Okay, informed steward. I like that. That might have to be a sticker that goes on my computer to remind myself as well. Yeah, awesome.
So, I mean, allow yourself, when the term, what are you doing for your self-care, how are you preventing burnout, when it gets kind of pushed onto you, allow yourself to just feel whatever you feel to fulfill that need of self-care. Whether it's a mindful cup of coffee, whether it's running a 5K, right? So you can still receive and achieve self-care through either one of those. Yeah. It's the self-talk and what you pull, the moments that you pull and create from those that can really help you take care of yourself. Yeah. Setting boundaries, taking those bio breaks, having that few moments in your car when you take that hat change. It's the self-talk that accompanies the self-care that's going to help you get through. I love that. That's so helpful. Thank you so much for hopping on here today and talking about something so important. And I love the way that you took that from another level of shame of what else you need to be doing and to owning it and being a good steward, which is always a good thought. So thank you so much. If people want to reach out to you or learn what they can do more, I know this will be going out to more than just the state of Indiana, but other nurse practitioners that are looking to get involved with their state associations, what's the best way to go about that? Yeah, so we have a website. You can follow us at indiananurses.nursingnetwork.com, and we're also part of the American Nurses Association. We have some burnout prevention programs through that platform that are free of charge. And as ANA members, ANA ISNA members, you can also access some applications like Headspace and the Calm app. Yeah, we'd love to connect. I'm also on LinkedIn. If you'd like to connect with me there, I'd be happy to continue the conversation. That's great. Well, thank you again, and we hope we'll have you back soon. Yes, thank you, Sarah. Okay, have a good day.